How China's coronavirus outbreak started. More than 9,800 people have been infected with a novel virus that originated in a Chinese seafood market, with the UK reporting its first 2 cases of the virus. On December 31, 2019, the World Health Organization's China office heard the first reports of a previously unknown virus behind a number of pneumonia cases in Wuhan, a city in eastern China with a population of over 11 million. Since then, the virus has infected more than 9,700 people in mainland China, with a further 98 cases reported from 18 other countries. Although the disease is mostly confined to China, where each of its provinces and territories have reported infections, coronavirus has reached as far as the US, France, Germany, Australia, Japan, Canada and South Korea, the United Arab Emirates, the UK, and Finland. 170 people have died, with no reported fatalities outside of China. The Chinese government has responded to the outbreak by placing Wuhan and nearby cities under a de facto quarantine encompassing over 30 million people. In the UK, British Airways has suspended all direct flights to China, while Hong Kong has suspended trains and halved the number of flights traveling to the region from the Chinese mainland. On Thursday, January 30th, the World Health Organization officially designated coronavirus a public health emergency of international concern, indicating that international action will be required to contain the outbreak. In the past decade, only 5 other public health emergency of international concern announcements have been made. How did the coronavirus start? The virus appears to have originated from a Wuhan seafood market where wild animals, including marmots, birds, rabbits, bats, and snakes, are traded illegally. Coronaviruses are known to jump from animals to humans, so it's thought that the first people infected with the disease, a group primarily made up of stallholders from the seafood market, contracted it from contact with animals. Although an initial analysis of the virus suggested it was similar to coronavirus seen in snakes, it now seems more likely that it came from bats. A team of virologists at the Wuhan Institute for Virology released a detailed paper showing that the new coronavirus's genetic makeup is 96% or identical to that of a coronavirus found in bats. Bats were also the original source of the SARS virus. The Wuhan market was shut down for inspection and cleaning on January 1st, but by then it appears that the coronavirus was already starting to spread beyond the market itself. On January 21st, the Western Pacific office said that the disease was also being transmitted between humans, evidence of which is apparent after medical staff became infected with the virus. Cases in Taiwan, Germany, Vietnam, and Japan also involved patients who had not been to China, implying that there has been some human-to-human transmission outside of China. What exactly is coronavirus? Coronaviruses are a large group of viruses that are known to infect both humans and animals, and in humans causes respiratory illness that range from common colds to much more serious infections. The most well-known case of a coronavirus epidemic was severe acute respiratory syndrome, SARS, which, after first being detected in southern China in 2002, went on to affect 26 countries and resulted in more than 8,000 cases. While the cause of the outbreak was initially unknown, on January 7 Chinese health authorities identified that it was down to a strain of coronavirus that hadn't been encountered in humans before. 5 days later, the Chinese government shared the genetic sequence of the virus so that other countries could develop their own diagnostic kits. Although symptoms of coronaviruses are often mild, including runny noses, headaches, coughs and fevers, in some cases they lead to more serious respiratory tract illness including pneumonia and bronchitis. These can be particularly dangerous in older patients, or people who have existing health conditions, and this appears to be the case with this novel coronavirus. Of 5 early deaths where researchers have analyzed the available medical history, 4 of them had underlying medical conditions that may have made them more vulnerable to the virus. How far has it spread? China has borne the brunt of coronavirus infections, so far. As of January 31st, Chinese health authorities have acknowledged over 9,700 cases and 200 deaths. Although the majority of cases are within the central Hubei province, the disease has also spread to Beijing, Shanghai, and Guangdong province. Outside of China, Thailand has reported the highest number of cases, with 14 people testing positive for the virus. Hong Kong and Singapore have 10, Malaysia and Macau each have 7, France and the US have 6, South Korea, Germany, and the UAE have 4. Canada has 3, Britain, Vietnam, and Italy have 2 while India, the Philippines, Nepal, Cambodia, Sri Lanka and Finland have 1 each. In the UK, the first 2 coronavirus infections were confirmed on January 31st. Details are thin on the ground, but at the moment we know that both people are from the same family and they are being treated in Newcastle. Britons being evacuated from Wuhan by the Foreign Office will be quarantined for 14 days after their arrival. In the US, the Centers for Disease Control and Prevention has recommended against all non-essential trips to China, while the UK Foreign and Commonwealth Office is advising against all travel to Hubei province and all but essential travel to the rest of mainland China. Russia, meanwhile, is considering closing its long border with China in an effort to contain the spread of the virus. Although there have been no reported cases of coronavirus infection in Russia, on Thursday Prime Minister Mikhail Mishustin said the border closure would be one part of a number of measures to prevent the virus spreading in Russia. What's going to happen next? While the number of cases in China is rising, there has been limited evidence of human-to-human transmission outside of China. The first confirmed cases of human-to-human transmission in Europe was reported in Germany on Tuesday, January 28, in a man who caught the virus from a Chinese colleague who visited him from Shanghai. Further cases in Taiwan, Vietnam, and Japan also involved people who had not traveled to China. After initially delaying the decision, on January 31, the WHO declared coronavirus an international public health emergency. Director General Tedros Adhanom Ghebreyesus cited the pace of the outbreak in China and cases of human-to-human transmission outside of the country among the factors contributing to the health agency's decision to declare an international emergency. Since 2009 there have only been 5 declarations of international public health emergencies: the swine flu pandemic in 2009, a polio outbreak in 2014, the Western Africa Ebola outbreak in 2014, the Zika virus outbreak in 2015 and another Ebola outbreak in the Democratic Republic of the Congo in 2019. If you like this video, and let's face it, of course you do, please hit the like button and subscribe for more fun videos like this from Subtle Facts.